I'm Sonia Azad. Welcome to The Shift, a place to inspire growth, resilience, and wisdom, real connection, healthy conversation as we navigate life's changes and challenges together. Because, as I like to say, we are all each other's teachers. Thanks to BTL Industries for making this podcast possible. Hair and makeup generously provided by Glam House Collective.
Hi, I'm Sonia Azad. Welcome back to The Shift. We're at Renew Beauty today in North Park, and I am back with Louise Prue. It is good to see you.
Good to see you too, Sonia.
We're going to talk today about maybe it's a taboo topic, maybe it's an uncomfortable topic, but it's something that you see a lot in your practice. Mm-hmm. And as we come into middle age, as we age gracefully, shifts in our bodies that we actually might not see but feel and experience. So how do I start this?
Well,
help me start this conversation.
I'm going to help you start this conversation. So many women, those sometimes who've just recently had babies, others who have aged gracefully, all have something in common. At some time in their lives, they feel the need to tingle. And they feel like perhaps that their youthfulness is gone because they are suffering from incontinence, and also which can lead to some sexual issues, including people who just don't feel very confident because they can't really go out and date without having to wear a pad. They don't feel good about themselves at the gym or going to classes because they're afraid of wetting themselves, and then more importantly in the bedroom. So it is a taboo subject, but there is good news, there's solutions.
This is giving me flashbacks to when I talked women's sexual health like a couple months ago. Mm-hmm. It is sort of uncomfortable to talk about, but I do like to tackle these topics, and I feel like you're the perfect person to talk to this about, because you've seen so many people come in and out with this problem, and you've been able to help them. When does this start happening?
Okay, it's an excellent question. So our pelvic floor, and again, let's talk first about the things that we try to strengthen. We strengthen our bodies through exercise. We strengthen our bodies sometimes through technology, but there's not a lot of things we do to strengthen our pelvic floor that perhaps most of us not knowing. We understand that Kegel exercises and things are very key, but how often are we doing that, right?
So I'm doing it now, just in case anyone's wondering, since you brought it up.
When we have girlfriends and we're all talking about, hey, does that happen to you? And this is what prompted me to really investigate some options. One of the ways that many people have told me that they were having better issues with incontinence with technology called Emsella. And it's just one of the things that we do here at our practice. So when we are looking at aging women, we think about people that are older. But actually, this issue can affect you as early as your teens. But for most people, it's after they have their babies. And what happens is after childbirth, it's very hard for the pelvic floor on its own to regenerate and to become strengthened. And many people go to exercise classes, but they probably don't Kegel as often as they should. And some also find that even perhaps the taboo topic of being in the bedroom and sexually not feeling as sensual or as active or as tight becomes an issue. And that is why I started to look at this technology. I've been in business for over 14 years, and myself being in my late 50s, I've never had children, but for the first time, I'm also experiencing when I cough or sometimes when I'm at the gym that I have this need or urge to pee. And so that prompted that discussion. And after dialoguing and having conversations openly with some of my clients, we found that it wasn't just me. It was for many people that we're talking to. And it got me thinking. So I talked to a great doctor in LA who told me that in her practice, which was primarily surgical procedures for prolapsed issues with respect to the pelvic floor, she was finding that surgeries were down because she was using a technology that was so simple. You simply just sit on it. You literally sit on this technology, and it does the equivalent of 3,000 Kegels in about 20 minutes. Yes. Okay.
So do you feel it?
Well, you feel it, and basically what it's using, if you think about the way a TENS machine works, so visualize a TENS machine. seat it within the seat, and you sit on it.
Okay.
So it's causing the pelvic floor to strengthen and tighten. And
so the muscle contracts.
Exactly.
Okay.
Yes. And recommended is anywhere between 4 to 6 treatments, although maintenance might be required. What was really interesting is after we brought the technology in, not only are we seeing people who feel more confident and not having the issues with incontinence, but many of my female clients were telling me that they were having some benefits in the bedroom. Their sexual wellness was being improved, and overall they were feeling more confident. And that's why I wanted to be invited to this talk today, because this is not a topic that's easy for anyone to talk about. And as I think about my friends and those who are in the know that understand that as we age gracefully, 40s, 50s, we might be in new relationships. We are dating again for some people, or we're finding that we need a little spruce up in the bedroom. And for many women, they didn't really understand what the issue was. We know hormones definitely can play an impact pre and post menopause, but there's something more. And when people are not strengthening their pelvic floor, that they're not exercising frequently, and perhaps also more importantly is that they're not doing their Kegels, it all has an impact. Your pelvic floor is very important for posture, it's very important for your overall wellness, and it's very important for your sexual wellness.
Okay, I have so many questions. Woo! All right, so let's say someone comes in, they're like, you know what, I'm gonna try this. So they sit on this machine,
right,
for how long?
For 20 minutes.
Okay.
For 28 minutes, rather, sorry. The first few minutes is a warm-up.
Okay,
Yeah.
gotta warm up, ladies.
And it doesn't hurt, and
Okay.
there's no downtime. You can resume normal activities.
So but you're clothed?
You're clothed.
Okay.
And we recommend that you bring a good book, although you can watch TV.
I don't think I could read and have that happening at the same time.
Yeah. Well, actually, there's a ticking noise, and there's also the sensation of like a TENS machine in that area. Okay. And when you leave, you don't feel anything different, other than you might sometimes some people experience mild cramping, but that would be the exception, not the norm.
Okay.
You just leave and you feel very naturally ready to go do your normal activities.
Okay.
And then with subsequent treatments, what you're going to find, and for what most of my clients have found, is that they become less likely to tingle. They don't feel the need to go to the bathroom as often. They're not getting up in the middle of the night to go to the restroom. And also, many of my clients have experienced where they feel tighter, and when they're in the bedroom, they're feeling that their sexual performance has been improved.
So you come in the first time for 28 minutes.
Yes.
And then when do you come back, and how often do you come back?
They recommend twice a week over
Okay.
the course of 3 to 4 weeks. We can see clients even a little bit more frequently since we are open 7 days a week, but recommended is to do a minimum of 2 treatments a week.
Okay.
And then you can do maintenance treatments after that. Truly, usually 6 treatments is a game changer.
6 treatments.
6 treatments.
Okay.
Over the course of 2 to 3 weeks.
How much does something like that cost?
That's an excellent question. So typically, the industry is charging about $300 a session.
Okay.
But when you're buying multiple sessions, and I'm a huge want to help improve the lives of women. And it also, by the way, it's not just for women, but it's also for male dysfunction.
Oh,
yes.
Okay, wait, let's talk about this.
Yes.
So tell me more about that.
This is a good question, because a lot of people don't realize that the pelvic floor, the size of the pelvic floor, and the atrophy that can occur is almost the same in a woman and in a man. And it is proven clinically that for many men, sexual dysfunction has been a big issue.
What about incontinence when it comes to men? Is that different?
It's not that it's different, but men experience it differently.
Okay.
For women, it's an obvious after childbirth that that's just going to be an issue because the area has been atrophied. But for men, it's actually an aging issue. So for many men, you're going to see that they're going to have improved strengthening, less incontinence, and possibly improvement in sexual dysfunction.
So is it the same 28 minutes?
It is.
2 times a week, 4 to 6 weeks?
It is. And we have many male clients.
Okay. What's the average age? Now here's where I start to get weird. What's the average age of the male clients who you see?
Finding most of the clients that come in to our facility, that are male, are going to be post 40 years old. So,
okay.
But those who have...
but that's not old.
That's not old. That's not old.
Yeah.
But where we're finding our male clients is the female that does the treatment and goes home and tells the husband or the partner.
Yeah.
That seems to be, how we're finding most of our clients. I think as the good news comes out and more people understand that technology is safe, there's no downtime, it's not invasive, it doesn't hurt to get done. In fact, no one even knows you're doing it because you're in a private setting and you leave and you go on with normal activities, that more and more people are going to realize this is an important part of feeling better about yourself and also having better sexual wellness.
Well, and I think people who understand anatomy know that all of this is connected, right? So
Right.
You're probably going to feel some of this, not just in the pelvic floor, but I would imagine in the lower abdominals, maybe the sides, and perhaps even the back.
Right.
Are there any people who you'd say, this is not for you?
We have no known non-candidates. I do believe those, however, that are under medical care where they may be awaiting surgical procedure for incontinence, such as prolapsed bladder, may want to consult with the doctor first to make sure this is a treatment that is an option for them. But there's no non-candidates, except, of course, somebody who is pacemaker or has a lot of metal in their body. They would have to have it cleared with their doctor first.
What has the response been since you started offering this?
Well, it's an interesting topic to have a consultation about. Typically, most of the clients that we've had over the years who have aged gracefully with our practice, the conversation really stemmed from originally where we had other technologies like M-sculpting and M-tone, which has been very popularized. These are technologies that firm and tighten muscles as well as reduce fat. And that same basis for the technology was in fact what came of Emsella. So the conversations that have been happening are typically when we're doing treatments and clients are chatting about their aging process and the kinds of things that they wish they could do to help improve. And so Emsella has become an interesting topic as a result. It's not the easiest topic to broach. I think everyone should feel confident when they go out. I think people should feel confident when they go to work or when they go to the gym. And more importantly, I think people should feel confident in the bedroom. And if this simple treatment is helping people in all those ways, why wouldn't we want to talk about it? And I've had many clients who have thanked us for being open about it and being able to have that discussion. Some of my clients have even told me, which is kind of cute, that it's their bedroom warm-up before they do their fun things.
Ooh, fun things. Okay.
Fun things.
Have you tried this?
Yes, I have.
Okay.
And I will say it absolutely works.
Okay. I don't think I should ask you any more about that. No, but and was it the same, like 28 minutes, like over 4 to 6 weeks?
Yes, absolutely.
What constitutes needing to go back for a, like, what do you call it, a touch-up?
Or a maintenance treatment.
Maintenance treatment.
Yeah, maintenance treatment. Well, just like if you want to maintain great weight and great health, you have to maintain great exercise regularly and frequently.
Okay.
So your pelvic floor over time is always continually aging. So it's going to be atrophying as we age. We know decade after decade there's loss of collagen, the elasticity in our skin changes. It's no different in your pelvic floor. So doing a maintenance treatment once or twice a year minimum is what we would recommend.
Why are we just now hearing about it?
Well, the technology has been out for over 7 years. It's part of the BTL M-sculpting M-tone technology family. I think the reason that you're not hearing it enough is because people are afraid to talk about it. And it's also an expensive investment for a med spa. It's not something you're going to find in typical offices, but I believed so passionately about the technology, especially after reading the FDA clinical results, listening to testimonials and clients who've actually experienced it, and then myself experienced it personally. I couldn't recommend a treatment more. And so simple to do. I mean, just taking 28 minutes of your day to be able to help you feel better about yourself and knowing that you're going to have a preventative measure for possible incontinence at a later stage in your life. Again, I haven't had children, but for me, it just started to come on in my late 50s. I regularly exercise, I eat well, I live a healthy lifestyle, and even myself experiencing that, I wouldn't want to go into my 60s, 70s, and 80s worrying about having to wear a pad or feeling uncomfortable in a social environment, or all the times you get up in the middle of the night, which happens to all of us as we age. And if there is anything that can prevent that, I want to be able to be a part of that client solution.
Well, I think what's so truthfully nice about you is that you do care about an overall human, and the well-being. And so as you're describing some of the shifts that happen in our bodies that we have no control over, or little control over, it's like that's got to be taking an emotional toll as well. Like to not, I'm thinking to not be able to just get up and go to the gym and move around in all the ways that I do, that would be damaging.
You lose your confidence, in every way. And I've had the pleasure of working with women for over 15 years in my business, and it has not only intrigued me, but it's made me very passionate about wanting to find solutions for women, particularly, which is the main part of our practice, because over time, I've seen women who have gone through changes and shifts in their lives, weight gain, a loss of energy, feeling like their hair is thinning or that they don't have control of their life. There's just a shift changing. And we can always blame menopause or the aging process, but the truth is there's a lot of things that we can do to prevent that. Healthy lifestyle, eating and exercising well, eating and exercising regularly, and more importantly, looking at innovative technologies like sculpting and other things like hormone replacement therapy or other anti-aging therapies that can help put back your confidence, so that can help you feel as good on the inside as you feel on the outside.
Is this a corrective process or is it preventive?
I think you can safely say it's both.
Okay.
So for those women and men who have dysfunction, or for those who are having problems with incontinence, this has been a clinically proven device to help reduce or eliminate that issue. So for example, women who have suffered with incontinence who might be considering surgery, like for prolapsed bladder, there are studies that have shown, and again, talking to physicians and other professionals as well as testimonials from clients, that they've been able to not have to undergo surgery, which is not an easy surgery. And it's also that surgery, the success factor is not the greatest. I'm not sure if most people know, but by the time you make a decision to do something about prolapsed bladder or incontinence, there are many studies that have shown that the surgical procedure may or may not be effective. And so this is a good, in my opinion, preventative. If you start young and you do it after you have a baby, that's a time to think about this procedure. It's so simple to do.
And I know in the yoga world, we talk a lot about how yoga and bar and Pilates classes specifically can strengthen the pelvic floor, and pelvic floor therapists are a thing now, right? So in concert with all of this technology, I think, people, men and women, hopefully feel more supported in aging gracefully.
You can only do so many Kegels when you remember.
I think I've gone through about 300 since we've been talking.
And I do need to tell you, someone asked me, and I'm always honest, they said, is it possible, because it is affectionately known as the O chair, is it possible that while you're doing the treatment, that you might have an O? And the answer is no. Not that anyone's told me, but it is a treatment that is, comfortable, but it's not going to sexually arouse you. Okay.
Now we know.
The taboo subject is now out on the table.
Is there anything else we haven't talked about that we should broach? No, thank you so much.
It's been a pleasure.
I really think this is important, and I think it's important that we bring it to the attention of people who might be like, oh my gosh, I didn't know something like this existed. Right. So that's why I do this podcast and invite people like you who are not afraid to talk on. Right. To share with me.
If you are experiencing any of those things, talk to a professional.
Right.
There are nurse practitioners specializing in functional medicine, as well as many physicians. It's part of our whole level of care. And if you seek out a professional, they'll give you the best advice.
Yeah.
It's part of the aging process, but you want to stay as youthful and as beautiful from the inside out.
Well, listen,
I'm be afraid to ask the questions.
I'm taking advice from this woman who's in her 50s, sitting right in front of me. Thank you so much, Louise.
It's a pleasure.
Thank you for your time. And thank you all for joining us for this episode of The Shift. Hey, as always, remember to like, share, subscribe, and comment. I love to see those comments. We'll see you next time. I'm Sonia Azad.
This podcast is sponsored by BTL, the makers of M-Sculpt, M-Tone, M-Cella, and beyond. For 25 years, BTL Industries has impacted the lives of hundreds of thousands of patients. A key global manufacturer of medical and aesthetic equipment, BTL operates in over 70 countries with an impressive team of 400 engineers. The leading providers of non-invasive treatments, they continue to innovate and find ways to improve the rapidly expanding medical field. And don't forget about our friends at Glam House Collective. Let's get glam.